Well, more people than ever in Wisconsin are getting their COVID-19 vaccines.
Meanwhile, AstraZeneca's vaccine could be on the U.S. market by the beginning of May, and that would make it the fourth vaccine available.
UW Health Chief Quality Officer Dr. Jeff Pothof joins us once again with our latest vaccine news. Good to see you, Doctor.
Good to see you guys, too.
A little bump in the road for AstraZeneca yesterday. They came out with some numbers, and then they said, well, the official said that's not exactly right.
Yeah, AstraZeneca's had a couple bumps in the road from, early on with some cases of, questions of neural problems, which kind of were found to not be related to blood clots, now to some questions about the data. And I think what it boils down to is the data cutoff for what they publicized was in February. And now, a month later, there's, more presence of variants that's likely to make the vaccine a little bit less effective. But I think, it'll end up turning out to be that the AstraZeneca vaccine is safe. I think we know that already, and it's still going to be highly efficacious. And I think, it could be something that we see here in the United States, just like it is something that 70 other countries are using right now.
Yeah, that's encouraging to hear. Okay, let's talk a little bit about, since so many people are getting vaccinated, which is really good news, are there still restrictions for people that have had both vaccinations?
There are restrictions, but, the game changes a fair bit. So if you've been vaccinated and it's 2 weeks after either your first shot of Johnson & Johnson or your second shot of the other two, your risk of getting severe COVID, being hospitalized or dying of COVID is very, very low. Some would say even zero. But until everyone's vaccinated, we still want you to stay your distance when out in public, wear your mask, just because we're not certain if people who are vaccinated could carry the virus and spread it to others who are not vaccinated. And that would be a way that we could get hot spots, especially with variants out there. So for the time being, we kind of hold the line, even though we're vaccinated. But your personal risk is low, and it won't be long before we won't need to wear masks. We won't need to distance because enough people will have been vaccinated.
Let's say you're with a group of 3 or 4 people that have both vaccines. Can you take the mask off at that point?
Yeah, if you're in a small group, especially if you're in a private place where you're not going to be in contact with others from the public, it is safe if everyone is fully vaccinated to take the mask off and, be close together if that's the activity that you're doing.
Well, what happens if you've had the vaccine? What happens if you're then exposed to COVID-19?
Right. So what we know is that for most people, you won't have any symptoms. You may not even be able to carry the virus, although that's not, answered yet. But you're going to feel fine. What we don't know yet is if there is a small chance that you could have the virus in you and spread it to others. Now, we do know that viral loads are much lower in people who are vaccinated, so the risk of spreading is lower. But for the most part, unless you're part of that 5% that doesn't really make a response, you're not even going to have any symptoms or know that anything was going on after an exposure.
Any pro tips on getting an appointment for a vaccine?
Yeah, that's what everybody wants to know.
Yeah, it's kind of a crazy time. It is really, try again. There's a lot of different vaccinators, and they all have different capacity of vaccines at different times. So I just encourage the public, to call around, check within Dane County, check outside of Dane County, and sooner or later you will find a spot that has vaccine that can vaccinate you. But, if you call that first place and they say, sorry, we're out right now, don't be dismayed. Just keep looking for it. Call that place back in a few days. And people are finding vaccine available out there. So it's out there. You just have to work for it.
And be patient.
Be patient and persistent. All right. Dr. Pothof, great to see you again.
Have a good afternoon, guys.
Thank
We'll
you,
see you
Dr.
next
Pothof.
time.
Thank you for your time.
Well,
You bet.
Final check of your forecast coming up.